Blood flow restriction training is one of the most powerful tools that we have for decreasing knee pain in order to get back to CrossFit, running, or weightlifting. But there are 3 common mistakes that I see both patients and clinicians make when they're trying to use blood flow restriction to rehab their knee pain. If you're frustrated with your lack of progress due to trying blood flow restriction and feeling like it's not working for you, or if you've never heard of it and you've stalled out on other techniques for improving your knee pain, you're going to want to watch this video. I'm Dr. Ryan, owner of Precision Fitness Physical Therapy, and I specialize in helping active adults with knee pain getting back to the gym and doing what they love. Before we dive into the specific mistakes that people often make when using blood flow restriction training to rehab their knee pain, let's talk a little bit about what blood flow restriction training is. The idea is simple. We use a cuff around the upper limb to limit how much blood is leaving the limb and going back to the heart during exercise. This creates an environment for that muscle to get much more fatigued much more quickly. Basically, you are doing an exercise with much less weight and getting to a similar point of fatigue, which is creating a similar amount of mechanical tension as if you were lifting heavier loads. You can use loads up to 20 to 30% of a 1 rep max compared to traditional strength training where you need 65+% of a 1 rep max load to really make good strength changes. This is really groundbreaking in terms of knee pain because oftentimes the thing that limits your ability to get into knee rehab is the pain itself in the joint from doing the exercises. Sometimes you can't tolerate doing enough load to make a change in the muscle itself, and that's where this can be a really helpful tool. So why does this work? The real driver of muscle strength changes occurs from mechanical tension, or time under tension is what is often referred to. So as those muscle fibers are being taut when you are doing a knee extension, for example, and you are putting load through that knee and targeting that quadricep muscle, that muscle is getting pulled on. And the longer that happens, or the more intensity with that happens from a higher weight or a higher load, that stimulates the muscle to then grow when it is done consistently over time in both strength and size. Blood flow restriction training just allows that to happen a little bit sooner because there's no blood leaving the leg when you're exercising. The muscle fatigues much faster and you can use up to half the amount of weight that you typically would. This is not only going to decrease the amount of pain in the knee, but it allows you to progress a little bit faster earlier in the rehab process. However, this is often where that first mistake in blood flow restriction training comes into play. A lot of people think that just having the cuff on is a magic bullet that is going to fix all of their problems. And even a lot of clinicians that aren't well trained in how to use blood flow restriction or haven't actually applied it with a lot of clients, they tend to just slap a cuff on someone's leg and they start doing exercises that aren't necessarily targeted towards the muscle that they're trying to improve, or there's a lot of compensations going on, and that is mistake number 1 that we're going to dive into. The most important thing to understand about this is the BFR does not build the muscle, the exercise does. So just having a cuff on the leg and doing a partial exercise is not going to make that many changes in strength improvement. You still have to work through full ranges of motion when possible, and you really have to do enough load or stimulus to make that person fatigued and actually build strength over time. If the patient is compensating like we just saw, they're using the other leg, or they're not actually targeting that quadricep muscle, no amount of BFR is going to fix that. If the quad isn't being worked, it's not going to get stronger. The reason this happens is often understandable. The patient doesn't want to be in pain, so they're afraid of loading the joint. The clinician is afraid of irritating that person's knee, but there's an important difference between protecting the joint and avoiding strengthening that muscle. With BFR, we can use very low loads to improve strength, but within that exercise, if we're not actually getting mechanical tension through a range of motion and we're not targeting the muscle the way that it should be, there's compensation going on, there is not going to be any adaptation to that muscle getting stronger. Comment muscle below if you've tried BFR but you have not been challenged or been feeling it in the right place, or if you've never done it and you want to learn more. Mistake number 1 is people thinking that BFR is a magic bullet and that just by slapping a cuff on their leg and doing some exercises, they're going to magically get stronger. I recently watched a viral video of someone using BFR after a knee replacement, doing an exercise with really poor form that they likely weren't getting much out of. It looked a little bit like this. So this person was using some TRX straps or rings to do a partial single leg squat, which there's nothing wrong with. But what they were doing, imagine someone after knee replacement, they were leaning back into the rings and using their arms to do most of the work here. So my leg and my quad isn't really getting much out of this. Yes, there is a cuff around my leg. It is inflated to the point where there's increased pressure, but I'm doing most of the work with my arms. I'm leaning back. The center of mass of my body is way too far back here. So I'm not really getting all that much knee bend. My quad is not really doing all that much work, but I am getting some tightness under the cuff here. There's not enough range of motion, and it's not challenging enough for that person. For this to be an effective exercise, it should look something like this, where there's actual knee bending going on and there's minimal pressure through these rings. And yes, I'll give them the benefit of the doubt. Maybe after the surgery, they didn't have quite enough control, and that's a great use for these, but there should still be a clear amount of bending occurring at the knee itself and a clear amount of loading going through that quad, and feeling like there's a lot of fatigue going on through here. This person was months out of replacement surgery and clearly had the ability to bend the knee further. They just weren't getting enough out of the exercise itself, and they're likely not going to get enough strength out of that either. In practice, this often means needing to do a simpler exercise where you're actually getting full range of motion of that quadricep muscle, and you're loading it in a way that is going to challenge it. It doesn't have to just be knee extensions, but this is a great example of getting through full range of motion and picking a weight that is going to actually challenge that person through those number of repetitions that is prescribed, and an appropriate pressure that's going to allow them to actually finish that exercise. It can be knee extensions. It could be doing something more like controlled reverse lunges, where they're going through that range of motion and actually using this front leg. And if they only have the ability to control partial range of motion at first and then work to greater depths, that is okay. But if that person is compensating using their back leg when they're doing a lunge like this and going down, they're not going to get much out of that. And that's the most common mistake that I see with clinicians that are inexperienced using BFR, is they let people compensate. They're not using the full range of motion of the joint, and that mechanical tension is never truly being built in enough of a way that it is improving the strength. More importantly, they're often not testing their strength of their patients in an objective measure. So if you're not having some sort of test that's being done to you in your rehab process to test out that strength and see if you're improving, there's no way to know that you're actually progressing along the way and getting stronger. Mistake number 2 with blood flow restriction training that I often see is not using an actual blood flow restriction training device and trying to wing it. A lot of people will just use a voodoo floss band, and they're going to try to wrap this around their leg to occlude their leg from blood going in and out of it. The problem with this is, as they're doing this, these floss bands are typically used for joint mobility, helping control pain, which they have good use for. But when you're just wrapping the leg either as tight as you can get it, or you're just kind of weighing that pressure, there's no true way to actually know how much blood that you are occluding in that process. Blood flow restriction training, to be done both effectively and, more importantly, safely, has to use a specific device that personalizes the pressure to your limb. Now, right now, my leg is absolutely being occluded from blood. It is very tight, way tighter than I would typically use for an actual BFR device that is measuring the arterial pressure in my leg and personalizing that amount of pressure that's then being applied during exercise to me. There's no way to know. We're just kind of winging it here. And I could, with a knee extension exercise, likely not going to happen, but with something maybe like heavier squats or lunges, I could actually injure myself because I'm potentially fully occluding blood in and out of that leg, and that can cause muscle damage or potentially even some artery or nerve issues that is not generally safe for most people to be doing. And it's also not measurable. So there's no way to know, are we increasing or decreasing pressure? Is this actually safe for that person? So I do not recommend using a voodoo floss band in terms of trying to actually use it for blood flow restriction training. It's not safe. We have to actually use a personalized device that is going to measure the pressure in your limb. You can check my previous video on what that looks like and make sure we're using that during exercise so we can track and measure it along the way and that it's safe for you. The width and size of everyone's leg is different. So don't use a voodoo floss band to do blood flow restriction training. It's not going to be safe. You're not going to actually know whether or not there's enough pressure or too much pressure to be doing this safely. That's where the personalized devices come into play. It takes into account the width of your limb and how much pressure is actually required to occlude that artery, and then use a certain percentage of that. Mistake number 3 with blood flow restriction training is incredibly common with clinicians or trainers that have some background knowledge as to what blood flow restriction training is, but they haven't really applied it enough to clients or had enough background education in how to apply it to really understand how it works. They think 80% occlusion is the gold standard and that's what they have to do. And oftentimes that leads to a great amount of discomfort for the client. So often I'll see people trying to do blood flow restriction and they're just in too much pain because the cuff is too tight. This can also happen with the voodoo floss bands. But as you're going through, you're going to see someone really wincing and grimacing. They're not going to be able to bend their knee all the way. They're even going to start to kind of shift away from that leg. And really now my right leg is doing most of the work as I'm doing this. I'm not getting through a full range of motion as I should on every rep. Or even with a lunge, I might feel really off balance or just too uncomfortable because the cuff gets even tighter as that muscle is contracting to get down into that full range of motion. Rather, you should be able to still control the motion. Yes, it should be tight, but it shouldn't be getting to the point where you are failing that exercise. If you're supposed to be doing 15 reps and you're failing by number 8 on the first or second set because the cuff itself is just too painful, that pressure is likely too high. And that's where working with an experienced clinician that has a lot of understanding in not only how BFR works and how it should be applied, but practical knowledge and has applied this with hundreds or thousands of clients and can actually make those adjustments to make the exercise more tolerable. Because if you're not finishing the sets, if you're failing really early on in the exercise, you're never really getting that mechanical tension in that muscle for a long enough period of time to get to the point where that muscle is getting fatigued. It's just pressure from the cuff that you're feeling and experiencing. And that is tricking you into thinking you're doing a lot of work. But in reality, there's not enough volume there and you're not making enough changes from a muscle strength component. It also really makes for really poor compliance. The number one thing with building muscle is consistency and then progressive overload. Both of those are going to be absent. If that cuff is too tight and you can't get through a full range of motion, you're going to end up quitting early. You're not going to be consistent with your blood flow restriction training because it's too painful. You're going to dread that process and you're not going to want to do it again. And you're certainly not going to progressively overload and add more resistance or more challenging exercises because there's too much pain from the cuff itself. And that's where making sure not only is the pressure appropriate from a standpoint of is it enough to cause changes in the muscle, but is it not so much that you're actually able to get through the exercise in an appropriate way. If done right, blood flow restriction looks like this. I'm still getting through a full lunge. I'm going through my joints full range of motion, but I'm not stopping early or losing my balance because the cuff is too tight and I'm in too much pain. The exercise type should vary. There should be various exercises that you're working on targeting that quad, both in weight-bearing and non-weight-bearing positions, but you should be working through that full range of motion. It should be very challenging, but you should be able to actually achieve the full number of repetitions that we're doing and not just blindly following a protocol, stopping sooner than you need to because there's too much pain or pressure in that cuff. And you're actually achieving all of the repetitions. A lot of people will blindly follow 30 repetitions in the first set and then 3 sets of 15. In those cases, sometimes they're either applying too much pressure or they're not applying enough load for that person. And in reality, you could probably increase that load a little bit, decrease the pressure, and have them get more mechanical tension under the muscle for longer periods of time and make much more strength changes. So while BFR can be very effective, it has to be done appropriately in order to complete the exercises that are prescribed, and it has to be progressed over time in a safe and effective way. If you're tired of struggling with blood flow restriction or you've never tried it and you just want to do it right the first time, make sure you go ahead and book a free discovery call with the link below. The patients that get the most out of blood flow restriction training are ones with a structured plan. It's personalized to them, not only in the pressure itself, as we just saw, but the actual exercises to target the right muscles, and that it is being progressively overloaded over time. So that means changing the pressure if needed, but more importantly, changing the load as things improve and pushing to the point where you are achieving muscle fatigue just short of failure, but not failing so soon that you're not actually creating a stimulus for that muscle by getting it enough time under tension. This can be really helpful for patients with knee arthritis who felt like they've hit a wall and don't have any other options, with CrossFitters who are looking to maintain strength in their legs while they can't load their knee during front squats, back squats, deadlifts because of knee pain, or for runners who are struggling to get their running in and their accessory strength training in because of that knee pain. And they want to find a different way to be able to load it and make strength changes without reproducing that pain every time and then being stuck not doing what they want to do for the next few days. If this is where you are, dealing with knee pain, struggling to load the joint, and feeling like your rehab has stalled, we've built a program specifically around this. It's an online BFR program that's personalized to your needs. We teach you how to use BFR appropriately, find personalized pressures, pick exercises that are going to actually make changes for you, and make sure that they're being progressed appropriately over time, very frequently, to the point where you are not making this too easy for yourself, but you're not also pushing it to the point of failure and not making progress because it's too challenging. If this sounds like something that would be helpful for you in improving your knee pain, there's a link to a free discovery call in the description of this video, and it will be pinned at the top of the comments. I want you to go ahead and fill that out, and we'll do a free discovery call to see if this might be a fit for you in order to get you back to the activities that you love with less knee pain and not struggling or hitting a wall in your progress. If this video helped, make sure you subscribe and follow along for continued tips on how to help your knee pain.